just been given 2 minutes. So what I will do is just touch on both, very briefly on both speakers. Firstly, thank you very much to both speakers this morning. Excellent talks, and really put where the international stage is, and now what I'm trying to do is to put where New Zealand is. Firstly, for research, I have to say that research is very, very alive, very robust, and very much in the minds of everybody, and we have some excellent units that perform research in New Zealand. The two big units are in Auckland and in Otago. Funding is always a problem, and that's where I take my hat off to Breast Cancer Foundation, Breast Cancer Cure, the NGOs that raise money and then direct some of that money towards funding. The Breast Cancer Foundation is involved in partnership with the HRC grants, and they are big grants of about $2,000 to $5,000 funding research, and then in a number of smaller but more important grants to researchers and scientists that look at innovative ways of molecular ways of the breast cancers. So Breast Cancer Foundation and Breast Cancer Cure both must be congratulated on putting a lot of money into research. There's also, from both big centers, there are quite extensive international collaborations. So New Zealand is very much part of the international research world. So, and David showed you that this morning. As far as education and advocacy is concerned, again, both organizations, and especially the Breast Cancer Foundation, puts a lot of effort into education. There's thousands of pamphlets on every aspect of breast disease that's out there for the patients and for the public to peruse. And of course, we always want to push the government to its limits to give us more funding for breast cancer. And that's how we got, and thanks to the patients that really, really pushed, that we got Herceptin treatment available for everybody. Coming to the next talk is the NPI. And again, all of us as pathologists, we used the Nottingham grading system. It's an international system. It's worldwide. It's recognized everywhere. And if you go to any pathologist or any clinician and you say, I have a grade 2 tumor, ductal carcinoma, they know exactly what you're talking about. And from a pathologist perspective, you know exactly what the pathologist that was reporting the tumor looked at and how he came to that diagnosis, he or she. So it's made a huge difference to the way we look at tumors and the way we report them. We also give, for every tumor, invasive tumor that's diagnosed, we give the NPI, the Nottingham Prognostic Index, and clinicians for a long time used this index to decide on treatment for the patients, as well as to tell the patients on their survival and prognosis. Currently, there's a few more systems out there. Adjuvant Online, as you would have heard, that came on board, but it hasn't been working for the last 18 months to 2 years. So other systems that the oncologists use currently are Cancer Map and Math and Predict, and they sort of give the same sort of survival figures. So it'll be very interesting and very exciting to get the new system up and running and have another tool in helping us to decide on what treatment options to offer to the patients, and also give an advice, educated advice on prognosis and survival. So with that, I